Yeah, so just for the next slide, so this is Ross. He's one of the developers who's been developing the NHS Online Orb. So Lancashire and South Cumbria, the pilot area for trialling the NHS Orb. So at the moment it's been in beta stage, so we're just, Ross will go through in terms of the timings, but we thought it'd be really good for him to show this to you, because again it's something else that we will be putting out there, and you may be getting questions about, but we'd really like you to get involved in a lot of the engagement on it as well.
Thank you. Yeah. Hello everyone. Thank you for having me first of all. So today I just wanted to take you through what the NHS Online is, what the Orb is. So it's a unique platform that we've created for one main objective really, and that's to drive up the adoption of digital services and the use of digital services. So what we started around 3 years ago was to understand what services existed, what the landscape looked like, and what we could do in order to affect digitisation in healthcare. And what we found was, like Andy Jean said, there's hundreds and thousands of apps and websites, so pretty much an app and website for everything that exists, every condition. And the problem was that many people didn't know about them. They don't know where to download them, and when they need them, they're not immediately available to them, so they don't. So they go to a GP surgery, or they go to a hospital. So we created a platform that we ended up naming NHS Online. There's a lot of contention around sort of what we called it, but it's the Orb is actually sort of our platform, because it's not just about health and well-being, but this version of Orb is called NHS Online Orb. So you'll see it's unique in design. It's different to a typical sort of layout of a phone, which is usually linear. We have icons, sort of multiple pages, and no real organisation to it. And what we felt was that that didn't provide a solution for all people. So we had to focus on all of the different type of people that were in a population. So some people, older people, needed it really to be simple to start engaging with digital services. And sort of younger people needed things to help them engage and actually find it interesting. So they did use digital services when it comes to health and well-being, because young people typically don't need health services as much. So the design is unique, and we'll tell you why we did that. But fundamentally what the app does, it allows any app or website to be centralised onto a single platform. So what we've focused on is not reinventing the wheel, we have kind of thing, but not reinventing the wheel in terms of the services that make up this platform. In fact, the Orb itself doesn't provide any of those services. So GP booking, as you can see, there's many services that you'll recognise there. And what we felt was that we needed to create a platform that made it really easy for all of those things to be centralised and then made available to an individual to access. So this is a citizen-facing platform, but all of the services that sort of make up the platform are just all different providers. So they could be the NHS, they could be private sector services. But it's all about sort of collaboration. So collaboration in terms of delivering the services, so all of those different partners, but also inclusion, so making it available for all different people, whether they're older people, younger people, or people with specialist requirements. So what is the NHS Online Orb? The best way for me to show this, because I could stand here all day and talk to you about it, and you'd probably think, what the hell is he talking about? So it's kind of new. So we put together a video to give you a really sort of deep, quick insight into what it is, what it looks like, and how it works. And then after that, I'll tell you about what's kind of coming next, if that's okay. But we've worked so hard to make this sort of like now concise. There's no way that I could do it as good as this and get the message across as well. So it's not about me being lazy, actually.
The NHS Orb is a platform for you to download onto a mobile, tablet or PC to access health and wellbeing apps and websites. It'll be free to download and use, and there won't be any unwanted ads either. It's just free. The NHS Orb will digitally enable many people. It will allow citizens more opportunities to manage their own health and well-being. Every aspect of Orb has been designed to make your experience as efficient as possible, including right from the very point the NHS Orb is downloaded. You'll be able to find the NHS Orb in your usual app store and download like any other app. Just type in NHS Orb and you'll see the NHS Orb icon. Press it, and once the download is complete, you'll be able to open the app. Orb provides immediate access to services that are already available for you to get things done online. Some of the core services that are available through most GP surgeries throughout the UK include: book a GP appointment rather than calling up and waiting on hold. Access your personal health record so you can see information about your own conditions or medical history. Access the 111 online service to go through a triage process to be aligned to the most appropriate healthcare service for your requirements. Access your GP surgery's website for local health information or guidance, or conveniently order a repeat prescription without the need to visit the doctor. Digitally enabling you fundamentally means arming you with self-care tools which empower you to manage your own conditions or health requirements. Every individual's requirements are different, but sometimes it's just about having the right services available at the exact point that you need them. If you need advice, guidance, or just someone to talk to, there are services and people available to help you and get you back to feeling like you. You may just want to find the best way to manage a cold or the flu, or access a quick guide to treating a cut or graze. The information and services available are vast. The NHS Orb creates a way of organising services for you to align, access, and then use. There are endless numbers of apps and websites available from other organisations, including pharmacy services delivered by well-known names like Boots or Lloyds, or services that many people may not know about, like the NHS Health Check service for 40 to 74-year-olds to check for early signs of any serious conditions. It may be that you simply need to find a local health service including urgent care, walk-in or minor injury centres. Through the NHS Choices paths, you can simply type in a postcode to bring up a list of what's close by. There are even digital services available to check A&E wait times at your local hospital, and paths which will give you greater visibility or understanding the services available. There are aspects to emergency healthcare which involve doing something to help others, and improve the chances of any of us in an emergency health situation. The NHS Orb aligns paths which make it really easy to read up about donating blood or organs, but also to do something amazing and become a donor. And remember, wherever you navigate to, you can press the core button to return home at any time. Although Orb has been designed to be simple and intuitive, there will be some features that you may want to understand a little more. Orb Assist will provide you with access to guides and training on how to use features and services on Orb, but also how to access or use specific apps and websites. Orb Assist provides a central place to access useful material to help you learn how to use digital services. Orb has been designed and created to digitally enable people by being adaptable to every person's specific and unique requirements. When we say all people, we mean it. We really want to make the Orb available to all, whether to meet the needs of an older person with a simplified version of the NHS Orb, maybe the alignment of specialist services targeted at younger people, or an Orb which provides a patient with tools to manage a specific condition. The NHS Orb will provide a solution to meet an individual's health and well-being needs, including people with long-term conditions, people with sight deficits, or people who have little or no experience of using digital services. Our aim was to create a platform that anyone can use to access digital services, so they can take control over their own health and well-being.
Okay. There's no way I could have done that and got it across and articulated as well. So, but what you can see there is an example. So that's just a configuration that we've gone through, made up of services that we think are quite generic and will probably fit for many people. But the idea and the concept is that an individual will have the ability to be able to add services that are relevant to them, because we think that empowering a person means giving them control and access. So you could see that down the line, if someone had diabetes, they'll be able to maybe select Orca, for example. So it's really about collaboration. Select Orca, find a diabetes app, and add a path to a loop. But it's about sort of how those paths are aligned, and we think that we've come up with a way that things can be categorised, organised, and then easily sort of signposted, so people can, when they need to use them, they know exactly where they are and they can quickly press them and quite simply use it as a first point of call, as opposed to maybe going to a GP surgery and then getting directed to a digital service. And there'll be many different versions and combinations, but it's not just about health even. We've created this platform so that it can work in any industry or sector. We're creating, for example, we're just launching now a Swansea University Orb, made up of 45 services for students. It was designed by students. They need to access 45 different apps and websites, and it's impossible for them to keep on top of them and to organise them, because typically on a mobile display it's just multiple pages, and those apps and websites are mixed in between all of those other services. So that's the main sort of focus of the platform. We've seemed to have had quite a good sort of feedback from most people. We've run quite a few engagement sessions with the help of Redmore Health, and we've spoken to older people, people with specialist conditions, younger people as well. Typically, when we've shown sort of younger people health services, they've found it quite boring. They don't really want to, even though they use a lot of digital services when it comes to health, they don't care because they don't use them that much. But it actually sort of got them sort of a bit more excited. They actually saw the interface and thought something different here, and they could get it, and they understood it really quickly. So what I'll do actually is, so just quickly, when this app is available, it's available now in the app stores on Android. It will be available on iOS on the 12th, so next week. We're not stopping there either. The way that we've created the interface is that it actually fits on a PC, on an Amazon device, in-house Alexa devices, so voice activated. It will be universal, and I think that it needs to be. So any device that someone has, they need to be able to access health services as easily as they could on their phone. So that's all happening now. So I was hoping actually today to announce the launch of Apple, the Apple version, but we've had to go through so many hurdles to do it because of Apple, but nearly there. But I'll just show you some of these other things as well. So I mentioned about the ability to be able to add services, so a person being able to adapt their version of Orb. So effectively you could look over someone's shoulder and it would look very different to your version. The same with something like Facebook. I don't know if you've done that, but I often find it strange when I look at my Facebook and then I look over my wife's shoulder and it looks completely different. The things that she's actually got sort of on her wall are completely different. So that's what you'd expect, because in truth, everyone's different. So, and it's only them that are able to often define the things that are relevant and specific to them. But this is called Orbit, so we've named this Orbit, and you'll be able to access this by quite simply pressing one button on the middle there, and a search bar comes up, and you could type in things like diabetes, you could type in fitness or anything like that, and it will come up with suggestions that you can quite simply press and add to your Orb. It's as simple as that. So you'll be able to press it once, and that's then part of your Orb, and that's adding an app or a website. So that's all we're doing here, is adding apps and websites. But on a mobile device, pretty much 90% of the things you have are apps. But lots of services are delivered by websites. Someone mentioned earlier. This platform effectively makes everything the same. So they're all paths. Whether and there's an app behind there or a website, it doesn't really matter. It's you just press a path the same. We've also thought about communication. So if we're able to get all people or all things onto one platform, and then direct people to one central place, that creates a lot of opportunities. Like, for example, the ability to communicate with them. So if you have an active user, whether you're the NHS or whether you're a third-party provider, subject to the consent, we've created something called Orb Beam. So you could send a message, for example, reminding people of the flu vaccination at a particular time of year. That ability then, just to be able to press a button and send it to 1,000 people or 10,000 people, as opposed to having to send a letter or do something on Facebook or an email. You've got people in a central place, so therefore it should be really easy to be able to communicate with them. And we get quite excited about this actually because we think it's very different, all mood. This differs to the likes of Trustpilot and review sites, which typically are historic. So if you give a rating or a review, then that's cast into kind of history, and if you want to go back and look at it, you can, and you can go through all of the sort of previous reviews. But we think that should be live. We think that a review or a feeling should be live. So what we've added in is the ability to add a mood rating against anything at any time and change it. So, for example, if you went onto the 111 service and you found it really good and you wanted to give it a really good rating, you'd long press it for 2 seconds and it would come up with this here, and you could move it to green. And that would say that I think this is really good right now. And if tomorrow they changed the interface and you didn't like it, then you could long press it and put it down to red. The benefit of that is that NHS 111 would see straight away that instantly, as soon as we updated the interface, no one liked it. So they could adapt, as opposed to getting a review and having to go through that historic information and try and establish what happened to trigger sort of a negative result. And then the final thing is, I've mentioned this already anyway, is Orb Universe. So this is not just about health services, although we think health is probably the most important thing to focus on because it relates to everyone. It's actually about organising and bringing any digital service together. So I mentioned the Swansea Uni Student Orb, which has many services. Actually, there's 45 services included in this version here. You've got an NHS version here, but you can have all of those things brought together onto a simple platform. So as a citizen, if you needed health services, you could press the NHS path and that would load up this orb quite simply on the outside. And if you was a student, you could press a student path and it would load up those services. So, I think what's going to happen over time is we're going to get more and more digital services, more and more apps, more websites, and it's going to be harder as a human to be able to organise them and use them. And if we get people to use them, it's good for all of us. It's digitisation makes things more efficient and helps people to use services more effectively. So that's what it's really about, the potential and the opportunity. For people, it's about getting convenient and instant access like you do when you book a restaurant table. And for providers, it's about increasing the adoption and the utilisation of digital services. So just now, what I'll do actually, Mark, do you know what it is on here?
Yeah.
I just want to show you sort of a video. So I mentioned we'd engage with lots of people, and I think it's important, rather than me just saying what I think, what people have actually said in relation to the platform.
Hi, my name's Frances, and I've just started to use the Orb, which I find is very useful, and I'm really pleased with it.
Hi, my name's George. I've just been introduced to the NHS Orb, which is very, very good. It has many, many different threads to it. You can go on to look at something, and if you, like me, I've had a stroke, so I can relate to my own stroke, but I can also look at things that might help me in the future.
So what do you like most about using the Orb?
The thing I like most about using the NHS Orb is that the layout's really easy to use, and it lets me have all my health information in one place rather than going to loads of different apps to get everything.
The Orb app is very simple to use, and it's like playing a game for more insightful information. Well, for myself, yeah, I'll download it when it comes online, and for family purposes and friends.
So you would recommend it to other people?
I'd recommend it, yes, definitely.
Intriguing, really intriguing. Just to have a look, even when there's nothing, just to have a look in it to see exactly what I can access, and it just makes me feel so much more comfortable, especially when I've got my granddaughter.
So what did you like best about the Orb?
I liked about the Orb is that it's designed like into all categories. Like if you pressed on your games, all your games would come up instead of them just all being bunched together like there is to now. Yeah.
I think that the children seem to find it so easy to use with the circular nature of it. They were just on it straight away. They knew exactly what they were doing. It just seemed so easy, and they were enjoying using it. So I think that just the ease of use, I think, seems to be the best thing.
I like the circle better because when it's like the squares, you can tap on nothing, whereas you can tap straight on the buttons. Yeah, there's not big gaps in between. It's easy to use. It's not just plain and boring, it's got loads of colour.
Clear, like, it's not like confusing.
It's something very different.
I like how you can like log your own information and you can find out stuff about other things at the same time because it's got information pages and things like that.
It's easily accessible. Everything's just in one app. So it's easy to access everything.
So that was just part of the feedback. We had lots more engagement sessions, but pretty much everyone that we spoke to liked it, liked the look of it, which I think is obviously the most important thing for us. Would people download it? So we've now just been building up to this launch, and it's happening now. So we're focused on Lancashire and South Cumbria. We've been engaged with various parts of the NHS over the last 3 years. We just felt over time we ended up here because it seemed to be more advanced in their digital strategy than anyone else, and had that sort of ambition really to drive something like this forward, whereas lots of the other parts seem to be sort of working on a lot of the components. So we're working with NHS England and focusing on Lancashire and South Cumbria as a pilot, but the ambition and the idea would be to roll this out across the UK to all people, to be a citizen portal for them to access digital services, health and wellbeing services, and then to expand on that. We're also engaged in sort of WOW separate, but from a different perspective. We're looking at local authorities and sort of student services, but the idea would be to bring health services there as well. So that's kind of sort of where we're at. Hopefully that's given you a good idea of what the platform is, what it does. Hopefully you've got sort of questions as well, but anything else, obviously I've tried to cover as much as I can here. Like Andy, I sort of had double the amount of time with Andy, but I'm still speaking fast. There'll be lots of other things that we could talk about, but I'm happy sort of engage separate and come out and see any of you as well.
We've got a couple of tablets here with the Orb on, so anybody that's got an iOS device and want to have a play around on it, we've got some here. We're going to plug Linda's, the laptop in for Linda's present because you've got to leave shortly, haven't you? Is that okay? So we're just going to, if you don't mind, if we do some questions,
sure, yeah,
probably after Linda's really, and then you can do that if you want to.
Perfect. Yeah, that's fine.
Is that all right?
No problem. Yeah, that's fine.